Hello everyone, welcome to our series Arogya for a Better Tomorrow. Today, I'm privileged to introduce you to Dr. Manasi Gupte. She has completed her bachelor's in dental surgery from Maharashtra University of Health Science in 2016. After working as an associate dentist for 3 years, she has established her own clinic, WellSmiles Dental in Thane in December 2019. Apart from clinical dentistry, she has also a vast interest in educating the masses about oral health. 6 months ago, she had expanded her practice to a multi chair setup. She has conducted and participated in numerous dental camps, which introduces a comprehensive dental checkup and training about oral health. Before moving ahead, I would like to introduce myself. I am Rotaract Shruti Nair from Rotaract Club of Thane Downtown. Rotaract is a youth wing of Rotary International that works with the welfare and development of community. Today, we'll be talking about dental care. As we all know, that dental care is something that we all are concerned about in our day-to-day life. So let us start our discussion by asking what is dental health.
So first of all, thank you so much Rotaract Shruti and Rotaract Club of Thane Downtown for giving me this opportunity. So your question, what is dental health? Basically, dental health, that is also known as oral hygiene, is a lifestyle or a habit of maintaining good oral hygiene practices like brushing, flossing, rinsing after meals, and so on and so forth.
So what can poor oral hygiene lead to?
Okay, poor oral hygiene, meaning failure to take care of your teeth, can lead to cavities, gum diseases, dental infection, bad breath, and in worst situation, diseases of the heart.
Okay, so can you further help us understand that how is oral hygiene and general health linked with each other?
Shruti, it is said that oral health is a window to your general health, and significant research has been done over the past years to prove that. For example, we know that our mouth harbors bacteria which are mostly, not that harmful. Okay. However, if you have a poor oral hygiene, that can lead to the rise in bacterial levels, which can cause dental cavities and gum disease. Okay. Further, if you don't treat your cavities or your gum disease, the bacteria will grow, okay, and they can enter your bloodstream, and some of them can reach to your heart walls, and the condition is called infective endocarditis. Okay, some other systemic diseases like your general diseases which can cause because of poor oral hygiene are pneumonia, cardiovascular diseases, and even pregnancy and birth complications.
Okay. So, what kind of patients are more susceptible to diseases of oral cavity?
So, parallelly, patients on certain medications like decongestants, diuretics, painkillers, antidepressants, or some premature conditions like diabetes, AIDS, osteoporosis, and Alzheimer's disease are more prone to oral infections and diseases of the oral cavity than a overall healthy individual.
Okay. How often should an individual visit a dentist and when we should visit a dentist?
That is a really good question, Retractus Shruti. In India, people usually wait for dental issues to happen before visiting a dentist. So we know better than that, right? We know that prevention is better than a cure. And that is the reason one must visit a dentist every 6 months.
Exactly, that's very true. So let's go further with our questions. What are the different types of dental and oral diseases?
Tooth decay, sensitivity, dental stains, malaligned teeth, bad breath, gum diseases, teeth grinding, jaw and bite problems are more common oral diseases. The less common but not rare include cleft lip and palate syndrome, meaning it is a birth defect wherein your lip and your palate are not fused completely. Okay, oral cancer, precancerous conditions of the oral cavity, and diseases associated with tobacco consumption and smoking.
So, talking about oral diseases, what are the most common oral diseases that are inflicted on us?
So, according to a survey, in India, about 85 to 90% of adults and about 60 to 80% of children have dental cavities, making it the most common oral disease. Others include sensitivity, bad breath, gum disease, and malaligned teeth.
So, first of all, what is exactly the reason behind and what causes these kind of diseases?
Like I said, everything attributes to just one thing, that is poor oral hygiene. That means improper care of your teeth. So that is failure to brush properly or rinse properly, or in some cases you have an improper diet, or you have some underlying medical conditions. Some of these reasons, they are responsible for the diseases like I told you.
I would exactly agree with that. Moving forward, how can we avoid these kind of diseases?
Okay, so you have to follow a good oral hygiene practice, that is brushing, flossing, rinsing. You have to avoid smoking and tobacco consumption. You have to visit your dentist every 6 months. These are the tips and tricks you can follow to maintain a good oral hygiene and also avoid all the diseases.
I would totally agree with you on this.
Okay.
So, asking further, how should we go about the treatment of these kind of common oral diseases?
Okay, so for a basic dental decay, okay, or a cavity as you know it, we do a tooth colored filling, okay, after complete removal of the decay. Okay, for a case of advanced dental decay wherein the patient has pain or swelling, we do a root canal treatment based on the severity of advancement, or in some cases we have to go for the extraction of the tooth followed by replacing the missing tooth. Okay, for gum issues, for issues where patient have a bad breath, okay, and the patients wherein patients have dental stains, okay, we do a complete cleaning and polishing of teeth. For malaligned teeth, we have options of metal or tooth colored braces. Okay, and now recent advancement has opened up the doors of aligners, or also which are also called as invisible braces. Okay, for teeth grinding or clenching, we give a soft or a hard night guard. For missing teeth, we replace the teeth with implants or make dentures as per the need and requirement of the patient.
Thank you so much for sharing your insights, doctor. So, moving ahead, what are the different ways that we can keep our gums and our teeth healthy?
That is a very good question. Following a few basic practices in our day-to-day life can help you maintain a healthy smile. Some of them include brushing 2 times a day with either a soft or an ultra soft bristles toothbrush. Okay, using a fluoridated toothpaste, that means toothpaste which has fluoride in it. Okay, you can ask your dentist about the best toothpaste for your teeth. Okay, flossing daily. Floss reaches the areas where a brush cannot reach. Okay, inculcating the habit of flossing can help prevent tooth decay because it cleans the stuck food particles in between the teeth. Okay, again, you should ask your dentist about the most favorable floss for your teeth. Along with it, it is a good habit to clean your tongue with a mild pressure tongue scraper. Okay, rinsing post meals helps clean the residual food particles which are stuck to your teeth. If you wish to start a mouthwash, don't forget to consult your dentist first. Apart from all these habits, your diet plays an important role in maintaining your oral hygiene. You have to limit your sugar exposure, especially sticky sugars, okay, and increase the intake of fibrous foods. This helps improve your oral health and minimize your tooth decay. And last but not the least, avoiding smoking, tobacco consumption can prevent various precancerous and cancer conditions.
So I can see a common theme you saying that do consult your dentist, everybody.
Yes, you should. You should not take anything which is over the counter directly, or you should not ask your chemist ki, आप कौन सा recommend करते हो? No. Just go to your dental professional. They will check your oral cavity. They will see what is the best toothpaste for you, what is the best brush for you, what is the best floss for you, how long should you brush, when should you brush. Everything they will personalize according to your oral cavity, so that is the best thing, right? Instead of consulting a chemist or over the counter anyone who is there at the pharmacy store.
I totally agree with you on that.
Yes.
So doctor, what can you tell us about wisdom teeth and what are the myths related to it?
Okay. Wisdom teeth, also known as third molars, erupt at 18 to 25 years of age. Okay, unlike your other molars, they erupt in a diagonal, that is a slant pattern. So in such cases, brushing or maintaining a proper oral hygiene, like your brush should reach that tooth, will help you maintain, keep the tooth free of decay. In cases where the severity is more, like the slanting position is more, we call it impacted molar. In such cases, because our brushes cannot reach the area and food gets stuck, a lot of tooth decay happens. In such cases, your dentist will recommend you to get rid of the tooth or extract the tooth. When the dentist tells you ki, you need to get the extraction done, don't worry about it, because third molars are not used for biting. Okay, often people ask their dentist, will my vision be compromised when my third molar is extracted? That is a myth, and that does not happen. In fact, when you extract your decayed third molar, your infectious bacteria in the oral cavity will come down, and your oral health will be restored to an optimum.
Okay, doctor, thank you. So doctor, what are the most 3 common things that a child can do every single day to keep their gums and teeth clean?
Okay, first and foremost is brushing 2 times a day for 2 minutes with a fluoridated toothpaste. You should ask your dentist for the brush, the toothpaste, the amount of toothpaste which is essential for your child. Okay, second, it is rinsing post meals. What rinsing does is help remove any stuck food particles, thus minimizing dental decay. And third is, and the most important one, is avoiding consumption of sugars, especially sticky sugars. Failure to remove stuck sugars during brushing can lead to tooth decay.
We all can understand, as kids we all had cavities growing up,
and all the kids love their candies and their biscuits. So please, this is a very important aspect which is often overlooked. So if you can limit your sticky food consumption, it will help prevent tooth decay.
Thank you so much, doctor, for sharing your insight. Concluding our today's session, I'm really grateful that we had this discussion with you. Thank you, Dr. Manasi Gupte, for being here with us. This session was very interactive and I hope our viewers will benefit out of this. Is there something that you would like to share to our viewers?
So I would like to conclude by saying, dentistry is not expensive, but your neglect is. So do visit your dentist every 6 months. I hope this video helped you a little more to improve your oral hygiene practices. I would also like to wish you all the best for your Arogya for Better Tomorrow project. And that's about all.
Thank you so much, ma'am. Bye, everyone.